Hi, everybody. Dr. Demito here. I'm sorry if I've been a little silent the last few days. I'm generally more communicative, but I unfortunately was diagnosed with what I thought was a cold, ended up being pneumonia. So I've kind of been down and out for a couple of days. I decided to pull myself out of bed today and shake this off and get going so that you don't have any questions related to week two content. So here we go for week two. Our objectives for the week include we have PowerPoints here for you to view and terms for you to understand. This week we're going to be going over hormonal regulation, female reproduction, those sorts of conditions. We have our readings here that we suggest you do. And let's see. Oops, I've got to move my little board here. And then we have our case study discussions, which you're actually going to expand upon. So now here we go with week two. And yesterday, your healthcare provider's diagnosis was revealed. And I want you to compare your diagnoses with that of the healthcare provider and notice any discrepancies. So I want you to go through each one and discuss any discrepancies that there may be. And based on that, I want you to notice any discrepancies and discuss those things. Then you need to develop a treatment plan. So this is a big deal here. It can't just be a little paragraph. This needs to be based on clinical practice guidelines, and I want you to use more than just up to date. I use up to date in practice, and it's a fine reference, but the best place to get your clinical practice guidelines is from CDC and from the professional organizations that represent that specialty. So, for example, the Infectious Disease Society of America, they are the organization that determines how antibiotics should be used for strep throat. The American Academy of Pediatrics identifies when throat culture should be done and which antibiotics are best to be used. So I want you to go outside the boundaries of the easy ones like up to date and examine CDC, American Academy of Pediatrics, Infectious Disease Society of America. You can also find guidelines on really good sites. One of my favorites that I go to is Association of Family Practice Physicians. Even though it's a physician site, I really like the resources that they have there, and they have really good teaching references for patients. And that's really a big piece of your treatment plan. So if you identify that there's going to need to be any follow-up, any referrals, this is the P piece of your SOAP note. And we haven't gotten there yet, but many of you have already formulated your notes using that SOAP note format, which is good. Maybe you've gotten some tips from other people who've taken this course, and that's great. And so we can work towards refining your SOAP note formatting and the content that's included in it. I know that we do have at least one student in our course that is on the education track. So I want you to understand that the information that you're gathering in this course may not seem as though it is going to be useful, but if you're going to be working as an educator, it is of the utmost importance for you to actually translate this content into your teaching modalities. So if you have any questions or concerns, please reach out. I believe that I did comment on everybody's postings. I generally do not submit grades until the end of week two. I kind of put it all together in a grade. So if I wouldn't worry If I see that something is off base, I'm going to communicate with that to you and have you adjust it and adapt it. For those of you who didn't formulate your note in a SOAP note format, please don't worry, that will not be held against you. Um, this is a learning process, and um, you'll move along and learn as we go. So don't worry about that. So have a wonderful rest of your day.